Welcome to tonight's event, The Exchange Live from Home, with a focus on mental health and self-care during the pandemic. Whether you're a longtime NHPR member or a first-time event attendee, we thank you for joining us. Our formal event is about to begin. Later this week, tonight's virtual event will be broadcast for radio. If you like what you hear this evening, feel free to listen again this Thursday, September 1st at 9 a.m. in the usual exchange slot on NHPR. And be sure to share with family and friends. In order to best facilitate our virtual event for later broadcast, here are some reminders for our audience. All attendees will be muted for the whole event. If you have questions or comments for our panelists during the conversation, submit them in the chat at the bottom of your screen. Be sure to select the option to share your answer with panelists and attendees, so other members of the audience can see your questions and comments. The exchange team will try to address as many questions as we can during the hour, and you can also stay tuned for the special bonus conversation after the formal event. We call it After Exchange, running from 8 to 8:30 p.m., where host Laura Knoy and our guests will be discussing the apps, tools, reading, and games they recommend for everyday self-care and that they're finding useful in their own lives. Finally, we can't do what we do without support from the community and our local businesses. Thank you to our sponsors for this evening: Anthem Blue Cross Blue Shield, Bank of America, Capital Roofing, Nashua Community College, and Systems Engineering. Thank you. Enjoy the show.
From New Hampshire Public Radio, I'm Laura Knoy, and this is The Exchange, live from home. Tonight's show is the last in our summer virtual event series, examining the impact of COVID-19 on New Hampshire and where our state goes from here. And today, how we're doing mentally, almost 6 months into a pandemic. Listeners, if you could put it in a few words, how would you describe your everyday mood? And how has it changed since March? Let us know in the chat. And for everyone, if you or someone you know is in distress or maybe contemplating suicide, you can call the National Suicide Prevention Lifeline at 800-273-8255. And if you or someone you know may be experiencing abuse, call the confidential New Hampshire Coalition Hotline at 866-644-3574. And the Veteran Crisis Line is 800-273-8255. Our guests are Nicole Sublette. She's a licensed clinical mental health counselor. Also, Linda Douglas, the trauma-informed services specialist at the New Hampshire Coalition Against Domestic and Sexual Violence. And Dr. Peggy Lannery. She is a certified executive coach and licensed psychologist, also a U.S. Army veteran who works with Camp Resilience, which leads retreats for veterans to help maintain their physical, psychological, and emotional well-being. And a big welcome to all of you. Thank you for being with us. And Nicole, I want to start with you. What are you hearing from patients that you see every day just about how the pandemic is making them feel?
Yes. So I'm seeing a lot of increased anxiety, levels of depression, frustration, fear, uncertainty. Is also shown up exacerbated relationship issues and also increased senses of overwhelm and isolation.
It's a lot to carry. I wonder, Nicole, are you seeing a huge uptick in the amount of people seeking your services?
Absolutely. With the current societal events, political climate, and of course a pandemic, I'm definitely seeing an uptick in people seeking services at this time.
Has the advent of telehealth, Nicole, and the fact that you can now see people over the phone or over the computer, has that helped you expand what you're able to offer people?
Absolutely. I think telehealth has been really wonderful. It's a great resource for meeting people where they're at. Some people don't have access to transportation, or some people have pre-existing conditions which limit their capacity to go out. And so telehealth really allows people to have access to care where they're at, and it's really wonderful.
Well, and as we discussed on our earlier virtual event, people also have kids at home now, so they also have childcare issues. Linda, I want to bring you into this too. What was your first thought early on in the pandemic, Linda, when you realized this is a worldwide problem? This is going to involve dramatic changes in the way we live our lives. What jumped to your mind, Linda?
Well, one of the first things that jumped to my mind was trying to just figure out how we were going to continue to provide services to people who were experiencing being abused by their partner in the home, because that increased isolation and being with the person who's hurting you, how do you make a phone call through that? And because you're living with them. So our programs immediately moved to start having a text chat feature on their website so that they could communicate sort of on the down low with people, so that they could be looking like they're texting somebody, but they were actually talking to an advocate. So there was that concern. And then the other thing is, how long is this going to last? Is because not knowing just increases the stress and can remind people a lot of the trauma that they've experienced before because they felt so powerless over the situation.
Well, I'm curious about that. So your first thought was, of course, to the people that you work with, people in abusive situations who you help with that. But you have worked with people, as you said, who've experienced trauma. How have you been thinking about this pandemic sort of broadly, Linda, in terms of trauma, this sort of massive traumatic event that we're all living through?
Well, one of the touchstones about trauma is that you don't have any control over the situation. You feel completely out of control because you don't have control over the situation. And that is what's happening with COVID and the pandemic response, is as individuals, we really don't have control over how long this is going to last. We don't have control over our lives in a lot of ways because the structures we had in place before COVID are no longer operating the same. So that feeling of being out of control can be such a reminder of past trauma that it creates new traumas and new anxieties in people that they may not even be able to relate to anything that's happened before, but it's just heightened now during time of COVID.
Oh, that's interesting. So the brain remembers the past trauma, even if it isn't conscious of doing so, and relives it.
Exactly. So a person can have that feeling of anxiety, and all the body is remembering is, oh, the last time I felt this out of control, and the last time I was wondering how things were going to end, I was in danger. I wonder if this is happening to me now. So people are reacting in different ways to that through their fight, flight, or fear response.
Dr. Lanieri, how are you viewing all of this?
Well, I just want to start out by being honest and saying that I have retired. I was working for the Veterans Administration, so I don't currently see any veterans, but I stay in touch with my colleagues, and I know a little bit about what they're dealing with. I've gotten involved through my church with a coping type of group for members of the church with another psychologist. And I can speak to what the people in my church are expressing, which really Nicole and Linda have already talked about. But I think it's a big time of lack of clarity, and that can cause you to recollect times in your life where you felt a lack of clarity or the powerlessness, as Linda said. And if there's prior trauma, it can make this difficulty, this unusual time that we're living through, exacerbate it and just make it seem worse.
Well, and you work with veterans, Dr. Lanieri, on resilience, and we'll definitely talk about that because that is a piece of this. But as a psychologist, even though you're not seeing patients currently, I wonder how you view this, Dr. Lanieri. COVID-19 is so often discussed as a health event, and we talk about precautions and health impacts. But how would you describe this, Dr. Lanieri, as a psychological event?
I think it's very significant because it's so unknown to all of us. The last pandemic was, I believe, 1914. unless you were over in Africa during the Ebola and the SARS scares. But it's just nothing that we've really thought about unless you're an epidemiologist, perhaps. So it's very foreign. It was quite abrupt. There was this lack of clarity from our government, first A, then B, then back to A, and that's kind of continued. Who do you trust? And the numbers just keep going up. Some people are dealing with personal loss. Some people are dealing with ambiguous loss, which is very significant. And a lot of the people that I talked to in my church, they didn't really understand the concept of ambiguous loss. But the loss of milestones, if your child missed a prom or missed a high school graduation, that's ambiguous loss. So it's a very big psychological event. I don't know how else to say it.
Well, I'm glad you talked about ambiguous loss because, Nicole, I was just reading about this today. The idea that, people have lost loved ones to COVID-19, and those of us that have not, feel grateful for that and for our health. But there is this feeling of ambiguous loss sort of coming at us daily. And I just wonder how you're talking to patients about that and helping people sort through that, Nicole.
So it is, it comes up a lot because there has been a loss around, rites of passage, even or non-rites of passage, ceremonies, weddings have been postponed, graduations, proms, and so there's, aside from, loss of loved ones, there's been loss all across the board. So what I do in session is, how do you cope and build resiliency with something that is so unpredictable? And how do you cope and build resiliency and also make meaning when there is loss? How do you make meaning from loss? And so we talk a lot about making meaning in uncertain times, and that seems to help people to really build their sense of resiliency and their sense of coping with what's going on.
Do people, Nicole, who have not lost loved ones, who have not gotten sick themselves, or, luckily still have jobs, do they almost feel guilty for complaining because they know it could be so much worse? But as you said, and as Dr. Lineri said, there are these ambiguous losses that pile up every day.
I have not yet heard guilt as a factor, even when things are going well. I think when things are going well, for people that it's going well for, I think they find it to be kind of a necessary respite, some necessary downtime from the stresses that they experience. And so COVID-19 and this pandemic has really shifted the way people engage. It has impacted their daily routines. And for some people, they're like, this is kind of the break I've needed. And for others, it's for people with families, they talk about having this increased connectivity with each other, because now they're having downtime where they didn't have it. Children were in sports or doing different extracurriculars. Parents were working. A lot of households have two incomes nowadays. And so there wasn't a lot of family time spent together. And so families are actually, sometimes being irritating each other or annoying each other. They're actually really enjoying this close time together as well.
Yeah, we'll definitely talk a little bit more about that in a moment. We asked our virtual audience to describe how they feel right now in a few words. Dorothy says, lethargy and procrastination. It takes 3 days to respond to a letter or voicemail. And someone else says, depression and anxiety is constantly on the fringes, so I have to be vigilant about keeping an eye on how much negative I voluntarily expose myself to. That's interesting to me, Linda. Someone has to voluntarily not expose themselves to too much negative, as they say. What do you think about that, Linda?
I think that is so true for so many people. It's when you don't have the structures in place that you had before and you don't have the routines before, you end up spending more time looking at the news, or you read things on Facebook or, all of these things, and people can go into information overload and they're not quite sure what it is that they can believe. So it starts to weigh down, especially right now when there are tragedies on top of tragedies. There's the pandemic, there's the racial discord, there's the protests, there's all of these things going on in our world that are just piling on. It's not just the pandemic that we're dealing with, it's so much else. And the coping mechanisms that people have had in place before may or may not be present right now. For a long time, people weren't able to go to the gym if that was something that they could do. Churches are meeting virtually. So it's all of this information that's coming in is constantly negative, and it's a constant reminder that things are not the way they were before March.
Dr. Lanieri, I'd love your thoughts on that too. Trying to keep out the negative.
I think for many people, it's quite important to try, and the word try is key, but set a limit on your exposure to the news and your exposure through social media to either factual or non-factual news stories, because news can be very upsetting, very depressing. And when you're trying to cope with a very challenging situation, I think it's just so important that you take good self-care, and good self-care does not include 4 hours a day reading the New York Times or the Wall Street Journal or whatever your news source is. It's a bad idea to keep doing that. So I totally agree with what Linda said. You have to set some limits.
And Nicole, Dorothy, who wrote in, said she's having a hard time just getting stuff done, making decisions. She said it takes her 3 days to respond to an email. I myself sometimes feel like I can't decide. I just can't decide. What is that sort of overwhelming sense about, that there's just so much information coming in at us that we can't even decide, whether we're going to wear the blue socks or the yellow socks?
Well, I think it's directly associated with levels of stress. And so prior to the pandemic, we had our normal levels of stress. And then so we add on a political climate, as I talked about before, the pandemic, and then, things that are happening in society, police brutality. And I think what's happening is that we're just becoming overwhelmed and overloaded. And so when we become overwhelmed and overloaded, we cease to have proper, sometimes executive functioning skills, because we're just too overwhelmed to properly make decisions for ourselves. And so I think that's what is happening. And then also sometimes our minds tend to also try to manage multiple things at once. And so maybe we're trying to do our regular and daily tasks, but then we think about, oh my goodness, what's it going to look like if I go out, shopping? What's my risk of exposure? What are my levels of safety? So I think there's also this pervasive hypervigilance, which is really taxing upon people's physiology as well. Just kind of always being on guard, which can once again impact our ability to make decisions.
That's interesting. And Dr. Lanieri, that brings up the work that you do with veterans. And I wonder what you're hearing from them about the impact of this pandemic. What Nicole just said made me think of that, because, veterans sometimes report when they're in battle, they're always on guard. And then when they come home, it's hard to let that guard down.
I was thinking of Maslow's hierarchy of needs as Nicole was speaking, and the most important piece is safety. And, we've all heard the stories of the veterans with PTSD. They sit with their back against the wall in a public place so they can see the door. And this is a very unique situation, because you don't know who could be carrying the virus. And if 2 people are near you without wearing a mask, do you avoid them? Do you ask them to, so I think this could be a very stressful time for some veterans with histories of trauma. I'm very involved with different yoga organizations, and they're going out of their way to offer yoga for veterans remotely and face-to-face in big open fields. And Camp Resilience is now starting to offer face-to-face retreats, which is, I think, very helpful respite for veterans.
Face-to-face retreats, so not doing everything online, Dr. Lanieri.
No, it's they're going to start, and the veteran has to come with a recent COVID-19 test. A negative test result has to be within 72 hours, but we're going to adjust how we've been operating, but they're going to be face-to-face retreats.
Well, more comments from our chat. Cynthia in our live audience has said she has loved the downtime. She says, I was able to focus on me for the first few months being out of work. She also says, I'm fascinated with the comment about how the current feelings of anxiety can trigger feelings of past trauma. Linda, can you address that again, please?
One of the things that we need to remember is that trauma lives in the cells of our bodies. It's not that it's in the brain where we can immediately recall it. So if there was a time where we had trouble breathing, for instance, I can say when I was a child, I was burned, and so I had trouble breathing during that time. And after that, so when I have trouble breathing, if I feel like I've got something over my mouth or if I'm being restricted or anything, my body thinks I'm in trouble again. And so it will react in order to defend itself, or it will react out of fear because my body's making judgments based on the sensation that it's experienced and is not able to maybe differentiate what's happening in my body from what's happening in the outside world. So that often makes sense to people because they're like, well, that explains why I'm anxious sometimes, and I don't even know why, because our body remembers, but we don't necessarily are able to recall that in our consciousness.
Wow, that's really interesting, Linda. So trauma, most people would think, oh, you remember a traumatic event, therefore it lives in your brain. You're saying it lives in your body also.
It lives in your body. And so your body can't tell whether or not you're in a traumatic situation or not. So sometimes if it could be an anniversary date. So today could, you don't remember, but you do remember that when the weather starts getting colder, something happened to me once when the weather started getting chillier, when the leaves started to change. And it may be in therapy with someone like Nicole that you're sort of sorting through that. And then you go, oh, that's when that happened. And that's why every September I start to feel depressed, is because your body remembers it before your mind does. And sometimes it really helps if you can work with a therapist to be able to sort out what that, I hate to use the word trigger, I prefer the word activation, but what is it that's causing my body to react this way to the weather? And it could be an anniversary.
Nicole, you mentioned earlier how people have a hard time making decisions because there are just so many considerations that they have to make. Again, bringing that mask to the grocery store. What do you do when that person gets too close? There's so much that is out of our control. How hard is it, Nicole, for people to just let go? We're often told, let it go. But how hard is that?
I think it's extremely difficult to just let it go, because if we think about the principle of letting go, what does it mean? Letting go can also be synonymous for loss of control. And that's really scary for a lot of people. So what I talk about and the frames that I use is controlling your perspective and controlling your internal world and controlling your internal dialogue, because we cannot control the external environment, but we do have some influence over our perception. And so when we talk about that frame of controlling your perception, or just even maybe slightly adjusting a thought. So it's just slightly better. It doesn't have to be happy, joy, but even if it's just a slightly happier thought, people feel more empowered.
Wow. Can you give me an example, Nicole?
So, for example, when I was working with a family, kind of talking about the pandemic, and the mother had a lot of fear of, maybe her children going back to school, and then, having COVID-19. And so what we discussed was, you can't control what's going to happen. You cannot control the external environment, but maybe you can control your realms of safety. And so we talked about maybe different options, hybrid options or virtual learning, but also a lot of talking about her perspective. Once again, you can't control what's going on outside, but how can you react? How can you be regulated and model attunement for your children? And that made her feel really empowered to be able to regulate herself and to model attunement for her children, because she felt like she didn't have control in other areas, which she didn't.
What does that mean, attunement?
So attunement means really matching or co-regulating with a child or a spouse. So meeting somebody, once again, where they are at, and really sometimes if there's a behavior, looking at the need beneath the behavior, and modeling regulation. So, if a child is, freaking out or having a tantrum, instead of maybe shaming the child, you can kind of find out, well, why is my child having a tantrum? Having a dialogue, and also not trying to have a tantrum over the child, but modeling how to be regulated.
Sure. Well, there's a lot more that we can talk about, including building resilience in these times. And we'll get a lot more commentary on our chat as well. All right, we're going to take a quick 30-second break. So refill your drink, grab a snack, have a stretch, or just sit tight. We will be right back. Welcome back to The Exchange Live from Home. I'm Laura Knoy. Today we're talking about how we're doing mentally, almost 6 months into this pandemic. Listeners, what have you been doing to cope and build resilience? Let us know in the chat. Also, if you or someone you know is in distress or may be contemplating suicide, you can call the National Suicide Prevention Lifeline at 800-273-8255. And if you or someone you know may be experiencing abuse, you can call the confidential New Hampshire Coalition hotline at 866-644-3574. And Nicole, all of you, but you, Nicole, first, you're a licensed counselor here in New Hampshire, and you work with many patients of color. What are you hearing from them specifically, Nicole, in terms of the current focus on police brutality, on systemic racism, on the protests? How is that affecting your clients' mental health?
It's definitely impacting their mental health in the sense of pervasive fear. So it comes down to the issues of safety, power, and control, and especially safety, because especially with police brutality for clients of color, there's certainly fear of being a target or a fear of being brutalized, which could very well be a reality. And then on top of that, there's also fear of safety for physical health and wellness. And also in these times too is in safety too, and access to care. I know at one point too, doctors dentists. We're, only seeing limited clients. I know things are starting to open back up, but people also are fearful. Well, if I get sick, can I go to urgent care, or will it put me at risk for, being exposed to COVID-19? So I think that my clients of color are really particularly being impacted strongly with all that is going on.
It's a lot to pile on emotionally all at once. And Linda Douglas, I wonder, any thoughts there about just the additional upset that many Americans may be feeling at this time? We've got the pandemic, and then we have a lot of sort of social upheaval.
I think that just multiplies everything. It doesn't matter where you stand on the issues, it's still very stressful because you're seeing these images from day to day, and you're getting mixed messages on what's going on. And it's also makes it hard to talk to people because you want to feel safe when you're having discussions with people, but you don't always know where that person stands on an issue. So some people will not talk about it with friends or family because in addition to everything else, they don't want to have the stress of hurting relationships that they're in because they differ on their viewpoints on so many things. And I know some of us feel very strongly about what's going on in the country, but I know I myself would be very careful talking to some people about it because I don't want to increase my stress, but I also want to be able to speak up. So people go through that. Who am I safe to talk to? Who am I safe to be around physically? It's all these, what can I do? Not only there's the added stressor of how can I keep myself safe, but also how do I keep my family safe, the people around me safe with all of these things going on in the world where you're worried about COVID. And I've had friends who've had children who've wanted to go to protests down in Boston or Manchester or even here in Concord. And they're not only worried about the COVID exposure, but then they're worried about what also could be happening while they're at the protest. So it just amplifies the worry for a lot of people.
We got a lot of people asking on the chat who want to know how we define resilience. And Dr. Laneri, I'm going to turn to you first for that.
It's our ability to bounce back from a traumatic event in mind, body, and spirit. That's how I look at it. It's a very broad term, and we promote it through primarily good self-care, communication, practicing mindfulness, protecting your exposure to negative events, as we've already talked about, going outdoors maybe once a day, staying physically active, feeling social support, so staying in touch with those you love and care about and communicating with them, whether it's by text or phone or a Zoom call, taking a shower or a bath. I mean, the list of how to cope to keep your resilience strong is extensive, and it's different for each one of us because, you know, my hobby, my interests are going to be different than yours, but it's important to do things that keep us feeling alive and are somewhat light as opposed to always exposing yourself to the heavy and the negative.
You know, Nicole, I'm curious, and a lot of the resilience strategies that Dr. Laneri just mentioned are definitely strategies that, you know, are out there and that people are aware of. But sometimes, Nicole, people are just so tired from dealing what they have to deal with on a day-to-day basis with this pandemic. And also, you know, if they're lucky and still have jobs, they're working and dealing with families and so forth. So how do you sort of get through to people, Nicole, that yes, you're dealing with all this stuff, but you also do have to take time to build your own resilience? It's almost like our to-do lists are so long now, and yet this is something else that we're supposed to do.
Yes. So when I talk to people about building resiliency, I talk to them about one, shifting perspective. And also they're here to see me because they have a desire to feel better. And that's why they're coming to therapy, to kind of get support, to help them with what they're going through. And so building resiliency and using various techniques is just a path forward to feeling better. And so we can build excitement around it, we can build joy around it, and we can build passion around it, and get people excited to start feeling good again. And so it becomes a less about, oh, I've got to make myself feel good again. It's I've got to feel good again. And, I'm feeling great. I'm going to get excited to do this and take care of me. And it can be very foreign for people to feel that, oh, I got to take care of me. A lot of people say, oh, no, that's so selfish, Nicole. How could I possibly take care of me? But when we're at our best and our highest, that's actually how we can help other people. When we're low and feeling down, then we can't really lift people up very high, can we? But if we're feeling high, good and great and joyful, we can help lift, other people up. And people really respond to that. They're like, yeah, I really could use some feeling good. So it's really wonderful.
Yeah, it's that, cliche, put your own oxygen mask on first, right, Nicole?
Yes.
You help other people if you're struggling to breathe yourself. Gail says, I tend to expect the worst rather than the best for the future when there are a lot of unknowns. And she says, this is a big unknown. Gail says, suggestions for worrying less and thinking more positively would be helpful. Linda, do you want to jump in on that?
I think one of the best things that people can do to be able to have a more positive mindset is to really figure out a way to help somebody else. And because then you have control over that situation. A friend of mine did this most wonderful thing through our church, because when we moved to virtual services, there were a lot of elderly in our congregation who didn't know how to use Zoom. And so this person made it her mission to call up people and walk them through, and she called it giving them directions to church. And she would walk through to help them get set up so that they could come to virtual services. And that was one of the ways that she got through it, because she had some control. This was a thing that she could do, and it helped. She's a fairly resilient person anyway, but this was something that she could do that really helped her get through this. And that's what I see is gardeners this summer are giving food away because that's just something that makes them feel good. People had wonderful gardens, all of these things that people can do for other people through this helps build up your own resilience and also helps other people during this time also.
And Dr. Lanieri, as we've been saying, you work with veterans on resilience. What are some of the tools in your toolkit when you work with those people?
Well, we have workshops. So the retreats that Camp Resilience offers, every day that you're there, there are 3-day retreats, and it's all free, are split in half. So the morning are the workshops, and the afternoons are experiential activities, whether it's hiking, kayaking, indoor rock climbing, but it's a combination of both, and then they have each other. So the camaraderie, even if you have a World War II vet and a Gulf War vet, they're obviously different ages, but maybe World War II is a bad example, Vietnam. And they really gravitate toward each other. And it's amazing to watch, because these men and women, many of the retreats are co-ed, didn't know each other before they got there, but these activities, the discussions in the morning with psychologists, social workers, life coaches, really bring out a lot of support. So peer support is a big part of Camp Resilience. It's not a didactic session like you need to take notes. It's a very back and forth, engaging discussion. And yes, we might teach the veterans about the fight and flight and the central and peripheral nervous system, but it's very engaging, and they have a chance to get to know us better during the afternoon activity, get to know each other better. So it's a wonderful opportunity for veterans to avail themselves of. And it's a great way, as Linda just said, for folks like me to give back. Other clinicians who still might have a full-time job get out of their office and they interact with veterans in a totally different setting than their office. And if you're retired, it's like Linda said with that woman in her church. It's my way of giving back, and I'm still surrounding myself with veterans, so I feel the altruistic value of this nonprofit organization. And I think when we behave altruistically, we feel better about ourselves. So it's a win for me as well. And I know I'm helping the veterans.
Well,
That
and
was a
you're
long
sure, and you're raising the issue of personal connection, which if we didn't know it before, we know it now. We need to be connected to each other. Human beings are social animals. We have a couple people in the chat who want to know about helping others. Cynthia wants to know, how can you help others who are struggling with an increase of depression and anxiety? Sandra wants some advice for how to support a friend. She says, a friend of mine who's in her 60s is obese, has heart issues, and has had bronchitis in the past, and is certain she will die if she catches COVID-19. Is there any way I can provide reassurance that death isn't necessarily the outcome? Any way to comfort her? Wow. And someone else in our audience says that they've been doing porch drops, surprise gifts, just a little reminder that we are not alone, even though we are out of sight. That is wonderful. Porch drops. I love that. What about helping people that we're close to who we are worried about and we can't give them a hug, and maybe we can't even go over to their house? And maybe, Nicole, we don't want to get on Zoom again. We've been on a screen all day long. What are your thoughts around helping people who you love who are struggling themselves?
So I think it's wonderful that we can, in this time, support and once again increase connectivity. And and maybe it won't be a Zoom call, but it could be as simple as maybe even a phone call, or sending a letter in the mail. I miss the days of receiving like even a handwritten letter. What a beautiful thing. Or my children really like to create art and then gift those out too. So I think it's wonderful. I think in our capacity to help people the best that we can, I think it's important. But also, I do really want to stress that if someone seems to really be struggling and they're not responding, then maybe, suggesting or recommending that they do seek professional help, because sometimes it is best handled in the hands of professions who can do a full-on assessment as to what's going on and, offer the therapeutic support that might be needed.
Yeah, so if you know someone who is afraid of dying, as this friend is, or have a loved one who feels that way, you seem to be saying, Nicole, you may not be able to help them with that anxiety. They may need professional help.
Yes. Yep, absolutely.
I want to ask all of you this, and Linda, I'll go to you first. What is the line, as you see it, between sort of manageable daily stress, we're all sick of this, we're all stressed out around it, and the point where someone really does need professional help? What is that line, Linda, to you?
To me, it's when that person's not able to take care of themselves. And by that, I mean what we call in the profession activities of daily living. If they have difficulty getting up in the morning, if they're eating too much or eating too little, if they're having difficulties with sleep, where they're up all night or they're sleeping all the time, it's just, there's a real significant change from where they used to be. And they may, if you're not hearing from someone for a while, check in on them, because right there, if they're isolating, that's a big one.
Dr. Lanieri, what do you think? Again, what's the line between, your average sort of stress and frustration and you really need professional support?
I think observing lack of activities of daily living is the first thing that comes to mind, as Linda just said, but also mental health. So rumination, you try to change someone's focus and something that's positive, and they immediately go back to their negative. In this example, the woman that is, certain she will die if she gets the virus. So I'm just going to exaggerate that. We talk about a recipe, something that she enjoys, whether it's crocheting or knitting. I think that I've got to redirect it, and then she goes back to her fear of death. If that happens 2 or 3 times, a couple days, I think I would have a conversation with my friend and say, I think you should seek professional help, because you're trying and you're a friend or a loved one. You're not a therapist. So that's another thing I look for is rumination, repetition, repetitive thoughts.
And just not being able to shake those thoughts, Dr. Lanieri.
Yes.
Nicole, how would you draw that line, and how good do you think most people are at drawing that line for themselves?
Well, it does go to activities of daily living and how much it interrupts your lifestyle. If you're really unable to manage, if you're unable to function, and also how are you coping is really important. I mean, if you find yourself having some coping tendencies that are not healthy for you, maybe drinking, or you find yourself smoking more, or utilizing substances, and if it's really, and also how is it impacting your work? If you're working, how is it impacting your relationships? Are you able to relate to other people? Are your relationships falling apart? And so I think it's hard for people to sometimes draw the line for themselves. And sometimes it's also, what feedback are you receiving from those close to you? I think that's also another important indicator. People are coming up to you saying over and over again, you're getting a repeated message, hey, I'm really worried about you. Because sometimes it's hard to identify those things within ourselves. And sometimes it takes the kind of look from the outside saying, hey, I'm concerned.
Well, at this point, we need to take another very quick break. So stand up and stretch, or refill your drink, or just sit back and relax, because we will be right back. Welcome back to The Exchange, live from home. I'm Laura Knoy. Today we're talking about how we're all doing mentally and emotionally at this point in the pandemic. And listeners, what about others in your life? How has this affected your relationships? Let us know in the chat. Also, if you or someone you know is in distress and may be contemplating suicide, you can call the National Suicide Prevention Lifeline at 800-273-8255. And if you or someone you know may be experiencing abuse, you can call the confidential New Hampshire hotline at 866-644-3574. Our guests are Nicole Sept. She's a licensed clinical mental health counselor. Also, Linda Douglas, the trauma-informed services specialist at the New Hampshire Coalition Against Domestic and Sexual Violence. And Dr. Peggy Lanieri. She's a certified executive coach and licensed psychologist. Also a U.S. Army veteran who works with Camp Resilience for veterans. And all of you, to this idea around resilience, we've gotten lots of questions in the chat about it. Kathleen wants to know, what suggestions do you have for keeping resiliency in the long haul when you've already felt down? And all of you have talked about strategies for resilience sort of right now to help you cope. But maybe to you first, Dr. Lanieri, what builds resilience in the long haul?
The first phrase that comes to mind is stick-to-itiveness. But how do you get that? I think each of us is a little different, but sticking to what works for you. And for me, it's schedules and lists, and I'm big into communication, and I reach out by writing, as Nicole said, to friends. I enjoy sending cards. I find value in that. I love getting them. But you really have to take good care of yourself each and every day, or the majority of days per week. And before you know it, the days kind of pass by fairly quickly because you're busy each and every day taking care of yourself and maybe being somewhat altruistic toward others, volunteering, helping the community. Those types of actions go a long way.
I wonder what yeah, go ahead, Dr. Lanieri. Sorry.
I was just going to say being kind, and each of us has different gifts. So how we practice kindness is going to differ.
I wonder what you think, Dr. Lanieri, with some veterans that I've talked to over the years. They've been through, terrible things, seen friends die on the battlefield and so forth. But sometimes these terrible things actually do help them build resilience. And I wonder how you can apply that knowledge to this time that we're living in. It's awful. No one wants to be in this place. But how can we use this to build our resilience? And I'd love to ask you about that, Dr. Lanieri.
I think that the expression, if it doesn't hurt, it builds character. But there's some truth to building character out of trauma and coming out stronger on the other end. It takes time to get there, but you can look at what happened to you and how you practice resiliency to become stronger, and then model it for the younger vets or children in your family. And the example of the Vietnam veterans bonding with the Gulf War or even Iraq or Afghanistan veterans, there's a large gap in their chronological age, but the Vietnam vets have learned a lot from their trauma, and they can share and model with the younger vets. So there's a lot of healing that goes on in these retreats, and you can do it in the community. You don't have to be a veteran. Meet someone who's been involved in protests for 20 years and talk to them, and what have they done and how did they get through those horrible times, take it into this time. I think there's a lot of wisdom that is around us, but we have to look for it.
Nicole, what have you seen in terms of resilience and patients working through what they're living through right now to actually improve their mental health?
So just to build upon what Dr. Lanieri was saying, is that with resilience, if you practice and through repetition, that can help over time to build resilience. What I talk a lot about with people is, having experiences that can distress us or they can be identified as traumatic. They can also fortify us and make us stronger, and then inherently also make us resilient. And so for even people listening right now, by experiencing and adapting to what's going on in this pandemic, you're actually building resilience without even consciously thinking of it. Resilience is being built. You are creating new ways of being and creating new ways of living and being creative with yourself as to how you can survive. And so we talk a lot about that in session. How are you now currently being fortified? How are you currently now being strengthened?
That's really positive, Nicole. I really appreciate that. So just the fact that we're all figuring out how to work and recreate and stay connected even with all the restrictions and difficulties and fears, just by getting through this day by day, we're becoming more resilient? Is that what you're saying?
That's exactly what I'm saying. And that's exactly what we are absolutely doing.
Wow, that's a very positive message. And it's good to think about it that way. What do you think, Linda? Building resiliency out of these horrible times.
Well, what both Nicole and Peggy are talking about is what we refer to as post-traumatic growth, where you actually grow out of the experience that you've had that you may not have wanted to have, that you really would have preferred not to have, but you learned ways of coping and you're actually stronger for having had that experience. And so people are looking at their lives and trying to find ways to strengthen. And I have an analogy about resilience where it's like a beach ball that if it's not inflated, it just sort of floats on the water. And if you push it down, it sinks. But if you fill that beach ball up and push it under the water, it shoots back up again when you release it. And that's all the resilience in there. And our job for ourselves and for each other is to make sure we keep the air in that beach ball topped off at all times, even when it's not experiencing the traumatic experiences, because you never know what's going to come around. So it's about maintenance. It's making sure that we're keeping ourselves in shape for if anything comes along. And a lot of us just weren't prepared for this. You know, it came along actually at the worst time of year when everybody already feels bad in February and March. Anyway.
Exactly. Yeah. No one was prepared.
Everybody's got the blues. But I also am so grateful it didn't happen in November, because then we would have had the long, dark winter. And now we've had the chance of the summer and the nice long days and a beautiful summer in order to be able to top off, our resilience.
So overall, last question for all of you. And Linda, I'll start with you, please. What lasting changes do you think we might see in terms of our mental health system once this is all over, or more broadly, in terms of just how society views the importance of social and emotional health, Linda?
I think access to healthcare, by doing it virtually, I think that's something we can never get away from, because I think there are people who would just prefer to do it virtually than having to go into an office, particularly when you're having trouble getting out of the house. So I think that's something that's going to stick around.
You said, Linda, and you're so right, when you said we were unprepared. How do you think this pandemic is going to change our mental health system? I mean, in terms of it having a positive impact on people's mental health. I'm not projecting here. I wonder what you think.
I think that's a hard one for me to answer. Because I think our mental health system particularly needs to become stronger and be built up so that there are more services and faster access to services for people. I think that's really important.
Nicole, what do you think? Changes in our mental health system, or again, just how much attention people start paying to social and emotional health? We hear a lot about this in terms of schools going remote, for example. Teachers say, I'm going to spend a lot of time just focusing on how my kids are doing.
Yeah. Well, yes, I think it's going to hopefully have a lasting impact on having access to care, which is, servicing people virtually and remotely. It's hard to predict how it's going to impact. I'm curious, about how it's going to long-term impact children, even my own children, as they're learning new norms and their own different developmental stages and what this means and how it might impact them. However, what I am seeing, though, are young adults, and this has been really meaningful. And so as young adults are becoming adults, they're really examining their own emotional landscape, and they're also examining the social and political environments very seriously, and they're really proactive, and they're really caring. And it's really wonderful to see, even though they have lost a lot of their rites of passage, they're looking at how can we how can we make a change? And I see that so much, and I really commend them for really managing this time. Some kids can't even go to college right now, or if they're doing it, their first year is going to be from home, which is not anything that they had ever anticipated or wanted. Yet they're finding new ways to cope and manage. And so, as I said before, it's also, once again, building that kind of resiliency. And people are actually seeing how they are strong.
Even with all the sacrifices that they have to make as young people, as you said, Nicole, young people are, very social. They want to be out. They want to be seeing friends. They want to be going off to college, doing their own thing. And some of them have had to give that up, but it creates resilience, you seem to be saying, Nicole.
Yes.
Dr. Lanieri, anything to add there about sustained changes that we might see in the way we approach mental health in this country?
Well, I just wanted to offer one statistic. There were approximately 300 to 400 students per week taking psychological first aid free trainings online a year ago. And the first week of April, 11,000 people took the course in psychological first aid. You do not have to be a therapist to practice psychological first aid, but many therapists are part of that 11,000. So I'm interested in seeing over time the acquisition of knowledge in the mental health field towards disaster management and trauma care. I think there's going to be a shift, and I think more colleges and graduate programs are going to be offering these courses to young students, and over time it will definitely affect providers out there. That's my belief.
That's Dr. Margaret Lanieri. She's a certified executive coach and licensed psychologist, a U.S. Army veteran who works with Camp Resilience for veterans. We've been also talking with Nicole Sept. She's a licensed clinical mental health counselor, and Linda Douglas, the trauma-informed services specialist at the New Hampshire Coalition Against Domestic and Sexual Violence. If you or someone you know is in distress or maybe contemplating suicide, you can call the National Suicide Prevention Lifeline at 800-273-8255. And if you or someone you know may be experiencing abuse, call the confidential New Hampshire hotline at 866-644-3574. And now, live audience, it's time to shift gears. We're going to take a quick break. When we come back, we'll ask our guests what they found useful in their lives, from books to apps to activities that help with self-care and resiliency. I'm going to give some quick thank yous before we do that. Our team here at The Exchange Live from Home is led by producer Christina Phillips, along with engineering from R.J. Perkins and Mark Erickson. Dan Toohey ran the cameras. Our executive producer is Michael Brindley, and Patricia McLaughlin is our director of marketing and communications. Tim Brady is in charge of corporate support, and the wonderful graphics and design you saw tonight are by Sarah Plord. This is The Exchange Live from Home. I'm Laura Knoy. And we're back. And all of you, thank you for that conversation. This is our after exchange. And I want to ask you about some of the changes that you have made or tried to make in your own life to help you cope or manage the stress. Also, live audience, the chat is still up. So let us know what you've been doing to cope and manage these anxiety-filled times. And Dr. Lanieri, let's start with you. What do you do for yourself to make yourself feel a little bit better?
As I already said, I've gotten involved. We only moved to Concord, Massachusetts last summer, so I'm meeting new people, and we joined a new church. I got involved in the church regathering committee. I exercise multiple days a week. And now that takes more time because you have to pre-register to get the weight room or pre-register to swim in the pool. Everything takes a little bit more time, but I still make a point to get there if I can sign up on time. I go on long walks. We have a dog who's 1.5 years old, lots of energy. He needs walks. My daughter's going back to college. She's 20 this Friday, but we've had 6 months with her back home. And that's been wonderful. So I've gotten involved with different community organizations, volunteering politically, and I also give of myself with Camp Resilience. And whether I'm up there helping facilitate a retreat in person or just talking to the president and other members of the board of advisors, I know I feel good about my interaction with that nonprofit, and I think they do really great things for veterans and first responders.
Dr. Lanieri, that must have been hard to move in the middle of a pandemic. It's not like the neighbors can bring over, a plate of cookies. Or maybe they can. I don't know.
Well, it was last summer, so
I see. Okay.
Here before, everything came.
Sure. How about you, Nicole? What do you do to kind of keep yourself sane?
So self-care is absolutely critical for me, and also because of the line of work that I'm doing, I want to be present and available for those that I serve, and also present and available for my family. So my self-care is pretty extensive, but I do have a daily yoga practice. I meditate daily or use guided meditations. Also just monitoring my diet, trying to be as healthy as possible is really important as well. And just doing things like reading or researching things that I enjoy, and also doing some projects working in social justice movements and things like that. Those are things that I'm passionate about. And so having a pandemic actually gives me a little bit more time to attend to things that I've always wanted to attend to.
And that giving back that Dr. Lanieri talked about, you're doing that too, Nicole, and that makes you feel a little bit better.
Yes.
You mentioned meditation. Are there a lot of apps out there for meditation and so forth? Do you kind of do it on your own, or are there any meditation apps or sites that you want to recommend to our listeners?
There's like the Calm app. I'm a big fan of YouTube apps. It's just so vast. It can be overwhelming, admittedly, though, because there's so many choices.
Yes.
But if I want to do a meditation, like a guided nature meditation, I can do that. Or if I, having stress, I could do that. There's so many things. There's also a tapping app for emotional freedom. So some people really use like tapping different body parts along body meridians to be very calming. So there's another tool.
Yeah, it's interesting. And our last virtual event, YouTube also came up as a way for families to kind of, get together and watch things that are fun, that just make you laugh. So that's interesting. And Linda, how about you? What do you do to help you forget the pandemic or just help you cope with it?
Well, I did a really smart thing when the pandemic started. I had been petless. I had had a cat that passed away in May of 2019, and I had been resistant to getting another animal. And what I did the first week of the pandemic was go to the SPCA, and I got myself another cat because I live alone. And I was on a bunch of Zoom meetings, and I was seeing people's animals coming through. And I thought, I cannot get through this, no matter how long it lasts, without a four-legged friend in my house. And that has probably been the one thing that has kept me sane, because she's affectionate, she's playful, she has been everything that I needed while I'm home alone. I also bicycle, so on nice days I like to go out and bike or walk in the woods. And I've fortunately been able to stay, very active with my job and with my church, but I still want to just sit back and say, if I hadn't gotten that cat the first Saturday that I was home working alone, and I'm in my 6th month of working at home, I think it would have been a whole different thing for my own mental health. So I can't say enough for that about
Wow.
that.
Wow. That's really, we would not be upset, Linda, if that cat made an appearance right now.
She has been so busy all day being a real pest. I had thought she would be here, but she is resting.
What about if people are, we had a lot of people tonight who contacted us and said, I want to build resilience. It's so hard. Are there any books, Nicole, or speakers, TED Talks or speakers on YouTube who might be useful resources for people to build that resilience that they're seeking?
That's such a tough question. I think it's so vast. And I think the resiliency, once again, is down to also what it resonates or aligns with someone. So for some people, maybe it might be, motivational speakers. But for other people, it might be just like a really good novel. So it's really, I think it's really kind of hard to pinpoint. But what I can recommend to people is, if you're looking to build resilience and well-being, really looking into like what brings you joy, what makes you happy, because for someone it might be gardening, or a lot of people have been baking lately. So there's been a lot of that, and there's been a lot of on social media baking sites too. Different recipes.
Well, for me, it's reading fiction, and my family knows once she's got the book out, don't talk to her. So that's my escape. We got some recommendations from our listeners. This is great. Jamie says their cat has joined us for this program. Thank you, Jamie. My cats have been helping me too, although they're getting a little annoying at this point. They're getting a little too used to me letting them in and out all day long. Kathleen says she's been reading The First Daughter, about Thomas Jefferson's daughter, doing actual baking and working temporary jobs. Cynthia says she has become a CASA volunteer. That's court-appointed special advocate, as I'm sure all of you know. And that, again, is that giving back that helps, and is reading more. Josh says he's been outside more. Running and bird watching have been very helpful. That's great. And someone else says they have been gardening and painting. So there's those kinds of activities as well. Did you want to, Dr. Lanieri, also just give recommendations about either books or apps or websites or, helpful or funny people on YouTube that you're connecting with?
Well, Nicole mentioned Calm, which is an app, and another app is Insight Timer. And then another app is Headspace, which after 7 days, I think you have to pay $6 a month or something. It's not a lot, but it's not free. Insight Timer, I believe, is free. And the VA has some, but I honestly can't recall their names. But I think YouTube is a great place to go, TED Talks, and finding what brings you joy, as Nicole said, is so key. Whether it's long baths or baking or gardening, long walks, I mean, the list is endless.
Yeah, it sounds great. And I'm thinking about parents of younger children who may be listening right now, and they may think, yeah, when am I going to take a bath when I have, 3 young children around? Nicole, you said you had kids earlier. I don't know what their ages are, but I'm just wondering how you sort of do that self-care juggle when you do have kids in the house.
Yes, my kids are young. They're 10, 5, and 1. So
oh my gosh.
They're pretty young. So how I do the juggle is I try to wake up before them. If I can. And then also I have the support of my husband as well, because sometimes I do take a bath because I need that extra element of self-care. Or I will work out and I will do yoga, and I will literally have my 1-year-old crawling all over me, and my 5-year-olds, my 10-year-olds doing poses alongside me. So I sometimes incorporate them into my self-care activities, and they really enjoy it.
Well, and you're giving them a good example, right, Nicole? You're saying, look, this is important.
Yes, yeah, absolutely.
In our last show about how families are coping, all our guests said that watching the videos that your kids are watching on YouTube is a great way to learn what they're into. So there's that connection there. And I think you mentioned that earlier, Nicole. Linda, how about you? Any recommendations for, books or comedians or anything like that
Two
you're
favorite
tapping
people.
into?
My two favorite people in social media right now are Tabitha Brown, who does these wonderful, she does cooking videos, but she also does these, let me just tell you, I know you need to hear this right now, but you will be okay. And she just has this wonderful way about her. And then for just fun, Leslie Jordan, the actor Leslie Jordan, he puts out a video every day. He just calls everybody the fellow hunker downers. And he was an actor who was on Will and Grace for many years and on other shows. So he's fun. So just anything, sometimes I will just sit and watch animal videos, and it is so wonderful when people take the time to share something uplifting on social media that we can all watch, some story that we've seen. And I think that can be something that we can just try to do every day, is just to find some feel-good story that we can post on social media just to get people away from all the ugliness that we see on there sometimes. And just so everybody can just for maybe 2 minutes just go.
Or longer,
nice.
Linda. That would be good.
Yeah, it would be nice.
Last night, my husband and heard about a very funny classical music conductor who did a very funny TED Talk about why everyone should love classical music. And I can't remember the guy's name. It was from 10 years ago. I mean, this was not new, but we pulled it up while we were making dinner and we were just laughing because he was really funny. And then we were sort of transported by the music, the clips that he was sharing, and he sat down at the piano and played. And of course, he had that great British sense of humor. So we really appreciated that. That was great. Someone in our live virtual audience says, at night, if I can't sleep, I will repeat the words, accept and adapt. Do you anybody have a mantra or something? Maybe they're not saying it, while you're lying in bed. But Nicole, do you have something you just try to keep coming, back to? Like, this too shall pass, or adapt and accept, like this person. Is there sort of a mantra that's helping you get through all this?
Yeah, absolutely. I have many mantras.
Depends on the day, right?
It really depends on the day. It could just be as simple enough as to breathe, or for me, sometimes just the word, I think, love or joy, or things that are really simple are mantras that I will use. And then sometimes I have like little sayings like around my house, just little pick-me-ups or reminders of whatever I want them to be.
How about you, Dr. Lanieri? Do you have a mantra or a saying or a prayer that goes through your head daily, or that you put on a Post-it note and stick up on the fridge?
Well, I love the saying, practice random acts of kindness. I have a wonderful T-shirt about do small things with great love, I think is the saying. But I just try to be positive, and I got this. I can do this. It's like Thomas the Train. So that would be another one. I got this. I can do this. Practice random acts of kindness. Smile.
Linda, how about you?
Mine is always breathe.
Oh, that's a good one.
Remind myself to breathe. And I'm fortunate that all my windows look out on trees. And so I can just watch the wind move through the trees, and I just stop for a moment and I breathe.
We got another fun suggestion. Again, something fun, takes your mind off of things, and maybe taps into our creativity as well. Our producer of this series, Christina Phillips, recommends recreating classic works of art with your family and your pets. So there you go, Linda, for your cat. And posting it on social media. She says, look up the Getty Museum Challenge for inspiration. And I've seen some of that. It's really, Really, really fun. Well, that is all the time that we have for today. And I want to thank everybody, our guests, and the people in our live event who participated in this virtual event. And a reminder, everybody, we're going to air the audio from tonight, this Thursday at 9 a.m. in our regular exchange slot. You can also find information for all the other virtual events at nhpr.org/exchange. Definitely check them out if you missed them, because we've really covered some great topics and had some great guests. This is The Exchange live from home from NHPR.